Don't say that, or don't say somebody's story in the name of motivation. Never say somebody's stories as motivation. Don't give negative hopes. If you can't give any hope, you can just keep calm. So these things has to be done. Don't physically touch, because there will be a lot of paranoia. There will be patients who have been victim of abuse. So if you touch them, they will misunderstand them, though there is a good intention for it. Don't use technical terms. Depression, mania. Never, in fact, never give any psychiatric diagnosis, because many people in disaster are normal people in abnormal situations. They are not psychiatric ill. These are normal people in abnormal. So you need not give any psychiatric term, which will again have difficulty for them to process. Don't give false promises. Don't use negative. So these are the things that you need to do in psychological first aid. You do psychological first aid in the big thing, period trauma, say tsunami or any disaster. These are the ways where you do psychological first aid. Now comes the second one, trauma-informed therapy. I'll give you an example. Now you are a psychiatric nurse. I'll give you two situations. You enter into a psychiatric ward. In other situation, you enter into a dermatology ward, where you should be, or where you want to be more trauma informed. There is a psychiatry ward, there is a dermatology ward, where as a psychiatric nurse you want to be more trauma informed. When I enter a ward, I should be thinking about, okay, bed number 3, Sulaiman has suicidal ideas. How is he? Number 7, Suresh is having delirium because of alcohol. How is he? Ramani in bed number 13 has suicidal ideas. How is he? That small young boy, I forgot his name, he was misbehaving with that ward student sister. How is he? So when you enter the ward, you realize there is some degree of trauma that is everybody are experiencing. See, a disinhibited young boy is not that he is not traumatic. He is also having trauma because of craving. So you are trauma informed. Unlike disaster, where you go into a very surrounded by disaster situation, here when you enter, you are trauma informed. If you are not knowing, you will be handed over at least. Okay, so that this is trauma informed therapy, where you realize that there is some problem. Next is recognize. Okay, today he is pacing and having a louder voice. Probably he is mania. Yesterday he was calm. Okay, now he is going around up and down. He is little irritable. He is little shouting. He is going to become agitated. Okay, load haloperidol and phenagal and give. That is recognizing. We should be ready, or inform the JR, or inform the psychiatrist. This is once you have recognized and you have realized intervention has to be done. And respond. Obviously, if some psychiatrists will say haloperidol phenagal, first dose you respond. This is trauma informed care. Here, I have given an example of not tsunami or not rape victim. I have given an example of psychiatric ward. It's a small team. This is very important. By stopping a mania, by becoming aggression, you are avoiding re-traumatization. Already at home you would have been very agitated, etc., and you would come here. That is your acumen. You observe that there is some behavior problem happening. I observe by my expertise and I avoid re-traumatization. This is trauma informed. If you understand, almost all the 4, maybe the third, except for the third one, all the 4 psychiatric nurses play important role. Because you observe, because as I said, you are the queens of the ward. You observe 24/7. You know that at morning 10 o'clock he was calm, at 1 o'clock he has become agitated. Something wrong. So you realize, you observe, you respond. After that only you are going to call the doctor. So trauma informed care. Even in a dermatology, what you are not going to be more worried about. So it is more of a policy. So Ninga as a psychiatric nurses or as a nursing person, you should come to a policy. Okay, people who are going into a nursing ward, a post-nursing ward, should have a standard operating protocol. And you should be a part of the psychiatric team in deciding. So this is called trauma-informed care. Okay. Next is trauma-focused therapy. It is very obvious. There will be a patient who is having panic attack, and he will be having, or a patient who is actively suicidal. You will say, what do you do? You give them sedation, call the doctor. Sometimes you may restrain also, call the doctor. Here, stabilizing safety, this is your part. As a nursing personnel, you will be very much involved in stabilization. Obviously, reconstructing trauma event, treatment and all, psychiatrists will take care. But especially the stabilization aspect, you will take care. And obviously, this is after in OPD basis where you reintegrate, you reunite with the larger community. Taking care of oneself, taking care of family, going to work, this is reintegration. This is typical treatment that every, say a patient comes to OPD, they do. So I establish safety, I treat by a psychiatrist, then they will reintegrate. So this is trauma-focused therapy. So to make things simple, trauma-informed therapy is a policy that the nursing personnel of say Indirani College of Nursing is going to make in a place where trauma is very high. For example, psychiatric nursing, psychiatric ward, sometimes in medicine ward where they can be delirium, or pediatric ward. These are the where you can have trauma-informed therapy. And trauma focus is a part of it. Here it is a general one. Trauma focus is the diagnosis. I decide on the diagnosis, I address. So this is about managing trauma event where you play a role, obviously in psychological first aid. You take care of psychological first aid, the full, from top to bottom you can take care. Because as I said, in psychological first aid you need not have much information, anybody can do it. All you need to have is calm and be patient and calm. Next one is, yes, trauma-informed care. Ingada, it's very important, you be aware. Once you enter the ward, you aware who is having problem, who is having suicidal idea. Be sensitive. Keep him in the, or keep her in the near a nursing station. So if you feel that bed number 7, Ramani has suicidal ideas, put her under bed number 1 which is near to the nursing station so that you can monitor her and be responsible. The last one is role in stabilization. Your role will be on stabilization. So this is about trauma therapy in psychiatric events. Yes, these are my references. Yes. So always have a positive mindset, which is very difficult actually, because when there is a big disaster, you yourself will be overwhelmed. So you have to be calm, you have to be patient, and you have to be giving a positive mindset. Thank you.
Thank you, sir. I request our moderators to review the session.
Thank you very much, sir. Actually, when we see trauma, we think of disasters and rage and all the color-coding, all those things. The one which is very neglected is psychological care. Today, the delegates, they might be acquiring knowledge on psychological first aid and the informed care and focused informed care. It's really knowledgeable, and also the empowerment can be done for both the parts, that is healthcare professionals, to identify and not to neglect anyone in any of the traumatic events. Because when we think any traumatic event, we are treated physiologically rather than psychologically. So this is a very important message by this session. Everyone, any trauma, psychological aspect should be focused. And thank you for sharing the valuable information, sir. And thank you for the insights you have shared.
Hello. Am I audible? Yeah. At this juncture, I like to point one thing. Say, I'll give you an example. It is not only the trauma is not only for the psychiatric patient. As I said in the first example, you go home after 4:30 or the shift, that comes with you. We have a lot of nursing personnel who have been abused or who have been sometimes made unhappy by fellow male psychiatric patients, and there are places where they never wanted to work there again, though they were trained psychiatrists. So that is also trauma. So that also has to be addressed. In fact, instead of addressing it, it is more to show them how to manage. Once they know how to manage, suppose there is an aggression patient, as a female psychiatric nurse, what you have to do has been said, they'll be more vigilant, they'll be more happy to address. Many times, as the previous speaker Natajan said, the administrative level, there is a lot of flaws when it comes to psychiatry. They always say, 10 patient தான பாக்குறீங்க, மெடிசன் ஹால்ல 20-30 patient பார்க்கறாங்க ஒரு nurse. Many times in say in IGMC we have single nurse for 3 departments: pulmonology, dermatology and psychiatry, because they think that it is a bed count, it's not the quality count. So all these things has to be addressed at the policy level. So trauma, here I focus only for psychiatric events. So when a psychiatric patient forms a community in the ward, which includes the doctor, MPWs, includes the nurses, who they can also be affected. Those things also has to be addressed. Thank you.
Thank you, sir. Thank you, ma'am, for the moderation. Herewith, I request Dr. Professor Mallika Kannan, ma'am, Principal, Indirani College of Nursing, to honor the resource person of the day with a small token of accomplishment. Thank you, ma'am.
Dear delegates, anybody having poster to display, kindly go to 4th floor, basement cell for displaying in poster competition. Dear delegates, we have inauguration program shortly. Kindly cooperate. Maintain silence throughout the program. Hope you are doing so. You maintain the same throughout the day. And after inauguration, we can have prayer. Dear delegates, kindly cooperate. We will start the third session, and in between of third session, we will have the inauguration program.
The capacity to learn is a gift. The ability to learn is a skill. The willingness to learn is a choice. Now the session is on Innovative Yogic Approach for Mental Health by Dr. S. Velkumari, Professor of Physiology and Faculty in charge of Yoga Center, Jitma, Puducherry. Herewith we welcome Dr. G. Indirani ma'am, HOD, Department of Obstetrics and Gynecological Nursing, and Mrs. G. Amuda ma'am, Associate